Many natural steps in life, such as learning to sit or walk, take a helping hand. Breastfeeding takes a little practice before it becomes as automatic as walking. Learning how to use your hands can make early breastfeeding easier.
I guess I'm having a little trouble.
You're having a little trouble with what?
Getting him to feed properly. He's having trouble latching on, and honestly, I'm getting a little sore. So.
Okay, well, let's work on it.
Partners play an important role in helping out.
I'm going to be showing Teresa some information, and when I'm gone, maybe you can kind of fill my shoes and help her out in the same way.
Okay.
I'm going to wash my hands for a minute. Take your time and get yourself sitting up as straight as you can in bed.
Early on, sitting straight up makes breastfeeding easier than if you recline. Begin with hand expression. Just a few drops of the early milk entices your baby to open his mouth. After your milk comes in, especially if you became too full, you could soften the breast to fit more easily into your baby's mouth when he latches on. So with hand expression, you can start the milk flowing, soften the breast for the baby, and encourage him to open his mouth wide.
And really relax your fingers more this time. So your fingers are really, really wide, and then pushing back and together. Good.
See.
So really far. And that's right. Exactly right. Okay.
The crucial step is for the baby to draw not only the nipple, but part of the breast into his mouth. His mouth should cover more of the area below the nipple than the area above. This way, the protected nipple is far back in the baby's mouth, pointing towards the roof. Here, the nipple is not abraded or rubbed by the baby's tongue or jaw. When the baby is latched on well, he uses his jaw and tongue to massage the area of the breast below the nipple. In contrast, when the baby is not latched on well, he can only suck on the nipple. There's very little flow of milk out of the breast when the baby uses the nipple as a straw. Milk flows well when he compresses breast tissue, not the nipple.
And now, when he latches on, if his lips are like this, your fingers will be parallel to his lips.
And out of his way.
And so, and out of his way, so he can latch on and pull the nipple back way far in his mouth. Now, let's say, for example, that he was on the wrong way. Let's say that he was just on like this. This way, he gets no milk out. If we get him on the right way, he uses his jaw and tongue and massages milk out of the breast. Okay? So he gets on the wrong way, you get sore, he gets no milk. He gets on the right way, you feel fine, and he gets fed.
Okay.
Babies love the combination of skin-to-skin contact and the smell and taste of the express drops of milk on your breast, a perfect way to begin breastfeeding.
Let's remove some of these barriers and get a little closer so he can get a little closer to his mommy.
Begin by positioning the baby with your arm running along his back, with your hand making a secure C at the base of his skull. His nose should be at the level of your nipple. This position gives you the best vantage point for seeing how the baby latches on. It's easier for the baby to draw the nipple far back into his mouth if the breast is first shaped into a sandwich. Your fingers will run parallel to the baby's lips and back away from where the baby's mouth will be. The baby becomes interested by the touch of the nipple and the smell and taste of milk, so tap his lips with the expressed milk and nipple. Wait for his mouth to open wide. The sandwiched breast is then positioned deep into the baby's mouth. Relax the sandwich hold only after the baby begins sucking and secures the breast in his mouth. Notice here, when the baby starts, his head is tipped up. The nipple points towards the roof of his mouth, not his tongue. His chin presses into the breast more than his nose, and the baby comfortably massages the area of the breast below the nipple. Now, if instead the baby is positioned poorly too high up, he must bend his head down. See how this makes it difficult for him to draw that lower area of breast into his mouth? More likely, his lower jaw will just be at the base of the nipple, and this could be painful.
And
Oh, he doesn't even want to. Yeah.
Well, some babies now.
Oh, ow.
Yeah, you see what I mean? Now, if we drew that imaginary line from the tip of his nose to his ear, midway in between is there, where the nipple's supposed to be, but it's right there.
It's not doing any good.
Yeah, so that he's just using your nipple as a pacifier.
Mm-hmm.
And that does not feel good, and that's how you get hurt.
The critical signal for your breast to make milk is to remove milk, especially this early milk. If your baby is removing milk effectively, he'll keep a sustained sucking pattern, not just a few bursts of 2 or 3 sucks. Many term babies take a couple of days to learn this. Premature babies take longer, and they can use the same hands-on help until nursing becomes automatic. While your baby is learning how to breastfeed, you can follow up each nursing with hand expression and spoon feeding. This would be wise for any mother who needs more help to build her milk supply, such as the mother of twins, or the mother with breast surgery, or the mother of a baby born a couple weeks early. Within a day or two, this will become automatic, and your baby will latch on without any help. Until then, your hands may help him learn.